Bengala, morning coffee. So I'll be streaming every day with morning coffee at 6:30 regarding topics which everybody would like to listen to. And what I see is, as a consumer's doctor, I'm going to inform you on a daily basis what benefits you the most. As this political storm is brewing in Washington, D.C., it doesn't matter who's going to be the next president. What I'm looking at as an individual, we can do a lot of things on healthcare. And healthcare is in a mess. We all know our healthcare system is dysfunctional. Everybody blames everybody. This is as a blame game goes on and on and on. You know, when we talk about dysfunctional healthcare system, insurance companies blames the hospitals and doctors, and hospitals blame the insurers, and doctors blame lawyers, and employers blame non-compliant employees. Politicians blame each other, and blame goes on and on and on. It's But as an American, we want freedom in healthcare. We really want freedom in healthcare. We can achieve that freedom. It's in your hand. It's in your hand. Irrespective of whatever happens in Washington, it's you are the ultimate decision maker, so-called decision. It doesn't matter who is in Washington, D.C. What I see is, either if you're unemployed, self-employed, or you're working for a company, you're busy with your daily schedule, and you're working for a large firm, it doesn't matter. Everybody can make money on healthcare, on your health. You can make money on your health. This is my ultimate goal. Everybody should be able to achieve that goal. You can generate revenue, you can make money, you can save money, put aside on health, on your health. Your health. Yes. This coffee is so good. Coffee is so good. So, how do we achieve that? You know, if you listen to Washington, everybody comes with one thing you hear right up front. These politicians, they says, oh, we need a comprehensive solution. Yeah, we need a comprehensive solution in healthcare. They think we are all stupid. They think we don't understand the healthcare. This is what it is. They think healthcare is too complicated. Yeah, they make it look like, oh, they come up with all sorts of, abbreviations, COB, CON, HTHP, CDHC. Oh, it's too complicated, man. Yeah, it's too complicated. And they make it look like we're all stupid. Yeah, that's what the impression I get. We're all stupid to understand the healthcare. There are two simple things, folks. Yes, there are only two simple things. One is a healthcare, second thing is health insurance. What is healthcare? Yeah, what is healthcare? What you receive the care from the doctors and hospitals and providers. That's what the healthcare is all about. We are talking about our coverages, folks. What is insurance? What is the insurance coverage? We're talking about insurance. What is insurance? Yeah, let me ask you, what is insurance? Yeah, insurance is nothing. It's basically how to finance for your care, how to finance. They're all intertwined, but how to finance your medical services. That's what the main thing. How do you finance your medical? And it's in your hand. It's don't look up in Washington. Don't look for these politicians to come up with a solution. They'll take forever to come up with it because everybody has their interests, folks. That's why they talk about comprehensive solutions. Every time you talk about comprehensive solutions, because you know what? They don't want to solve the problem. The most of the because in 19 actually but in 2019 we spent 17.8% of the GDP. Can you imagine it? For the first time it has surpassed the national defense budget, folks. Yes, whenever there is a that much expenditure, 17.8 of the GDP I'm talking about. How much India spends on the GDP on the healthcare? 1.5% of the GDP. We have spent 17.8% of the GDP. You tell me where the money is going. God only knows, man. God only knows. It's frustrating. Why does it cost so much to receive a care, to finance a health care? This is, the reason being they're lobbyists in Washington, D.C. They pump the money into these politicians. They never come with the solutions, folks. Americans want freedom in healthcare, total freedom. They don't want anything to do with what they do it in. We want freedom to see any doctor, any facility, any place. We want total freedom, nothing but a total freedom. And it's achievable, folks. It is achievable. How do you do it? It's just a matter of, it's in your hand. I'll tell you how it is. How does it do it? It can be done. It's just a matter how you do it. I will be addressing that every day in the morning. I'll be streaming at 6:30 for morning coffee with Consumers Doctor. They're simple, folks. You can achieve your independence in healthcare. You can achieve total freedom in healthcare as long as you follow certain guidelines. It's very simple, folks. If you, this is an asset. Why it has to get into our head. This is an asset. We'll all have to take care of our asset. What do you do when you have an expensive car or when you have it? It doesn't matter what expensive or you. Even if you have a car, you cannot drive a car without insurance. Can you? How can you live without insurance of your own asset? This is what it is. How can you live without having your asset protected? You need insurance. These insurance lobbyists are not looking after you, man. They're not looking after you. They are looking after themselves. This is the problem. They're looking after themselves. If they're looking after you, you won't be in this position. You need to wake up. You need to wake up. What I'm saying is we all need to wake up regarding the health, because this is an asset you need to insure. So whenever you talk about insurance, this is where we have problems, but we can circumvent the present policies. What these Washington has, these health coverages, they're all screwed up, they're all messed up, but you can do something about it. Yes, it can be done. It is achievable. What I'm saying is take control into your own hands. How do you do it? It's very simple, folks. It's very simple. If you're self-employed, you're working, you're making a living, you're having a, you're not making a, at least you're having an average income, folks. And there are 180 million workers, blue collar work. It's in your hand. You have a job. You're making money, but you're not putting the effort on how to be totally free from healthcare. You're listening to all this secondhand information, which you're not getting it right. If you really look at the logo here, health insurance personalized. How do you personalize health insurance? Yes. How do you personalize it? It can be done, folks. I'm telling you. How do you we need a personalized health insurance, man. How do you personalize a health insurance? Okay. If we look below that, what is this stupid abbreviation? HTHP, HSA.com. I came with that because people, these abbreviations are confusion, but it's simple, folks. HTHP. If you Google for a HTHP, they'll come up with lots of premiums for your health coverage. But I renamed, it's not a deductible plan. Forget about the deductible part and all that. Again, you will learn that. But what this is, health disclosure. When you go to the insurance company, you fill up a form, you have to disclose your health. Then you will get a healthy premium. So when you go to the HTHP, you fill up the application and it will give you the quote. HTHP quotes are very reasonable, folks. It starts for an individual, it starts with $156 a month. $156, it goes to $180, but HTHP accounts are reasonable because there is a deductible factor in it. Initially, you can have 1,000 or 1,500. Your premiums may be a little higher. I would advise you to fill up that stupid application, HTHP. Get that coverage. And once you have the coverage, the rest is history, man. Rest is history. What I'm saying is, by having an HTHP account, we waste so much money on everything else, all this. We waste so much money on going out and spending the money. You can put money aside and if you're not insured right now, there are 28 million folks that are not insured. And people are insured, 170 million people, 176 million people who have insurance. Wake up, man. Go to the human resource and find out. I don't like this insurance, what we have. I want to get the HTHP up. And employer will subsidize. I'm telling you, employers will. It benefits the employer too. It benefits the employer and an employee alike. If you go to the human resource and ask them, I want an HTHP account, and employee has to, whatever the money they're spending on your healthcare, have them put aside into your health solutions advantage, HSA. Whatever your employer is spending on your health insurance, you can suggest them, I want that money, whatever the money being saved with the low premium, put aside into the health solutions or HRA account, health reimbursement. Employer still controls the reimbursement account, but at least you're putting money aside into the reimbursement account, which right now, the way I see it, employees have a control. It's portable. One thing I don't like is health reimbursement accounts. Year after year, it doesn't accumulate. That's why you should go for a health solutions advantage. You can talk to your employer. If you're working for a small mom and pop, small businesses, even if you're working for a large company, most of them are self-insured. So you can request for it. As a matter of fact, these unions, man, they should They should go for this. All this UN, big membership of the union sector, they should ask. Because you know why? What we are doing here is every year your employer is spending, for a family of four, is spending 14 to 16 to $18,000 every year. Where is that? Year after year, year after year. Employer doesn't see it, employee doesn't, and it goes, it disappears. And I multiplied 176 million with 16 or 18,000. It came to $2.88 trillion, folks. That money is gone year end. You don't need, and also these insurance companies have to wake up. These insurance companies, what they are doing is they keep rising your premiums. The reason the premiums are going up, because they're not segmented. You need to have risk segmentation. They give you the premium on a risk pool. You're sharing with the entire country, entire population. That needs to be segmented into the, if you're in a well category, your majority of the Americans are in the well category. Your premiums have to be low, and they have to be transparent. They have to be transparent. Why we have the way it is structured, I just don't get it. Why do we waste year after year? We are spending $2.88 trillion, wasting 2. If that money should be invested in us, in Americans, and you and me and everybody else, we can put money aside into our savings or account. Health HSA, it's called health, so-called health solutions advantage. I won't call it as a savings. It's a health solutions advantage, folks. It has a triple tax benefit. How about that? Triple. Employer can deduct it too. If you're if all employers out there, if you're listening, I'm an employer too. I'm trying to address all the employers out there. It benefits you guys, all the employers and employees alike. You can write it off in taxes. You don't need to, whatever. Health solutions advantage, the beauty, triple tax. Number one, contributions are deductible. It doesn't matter, employer and employee. It's deductible. And the returns on you can put aside for an individual $3,800. It roughly like $300 a month. And if for a family of four, you can put aside up to $800. $7,500, I would say. You can put aside $750 every month. By year end, you'll have at least $4,000 and $8,000 by year. For a family, they will be able to save $8,000. Can you imagine? Whatever, $4,000 year end, 10 years it'll be 40,000, 20 years it'll be 80, and compounding it in no time. By the time in 10 years, that 40,000 becomes 50 to 60 to 70,000. And they're not the compounding, whatever, because it's invested in the market, the returns are not taxable. And withdrawals are not taxable either for your health. If you're spending money on your health because they have a debit card, they're not taxable. You don't need to pay taxes on your health because you're using that money for your health. So there's a triple tax benefit. Why can't everybody embrace that? I would like you to join Morning Coffee with Consumers Doctor. There's nothing like having a coffee and talking to you people. I would love to communicate directly with you how to make money on healthcare. This is my goal, man. This is my goal till I die. I want everybody to make money on health. Yes, the beauty about, this is, you're not making money for anybody. You're making money for your own health. And you can put money aside. You don't need these surprise medical bills. These insurance companies and this, the the providers, they need to wake up, man. This billing system needs to go away. This billing system, surprise medical bills. I don't like it. And these private insurance carriers, they have such a strong lobby. They just follow the Medicare. Whatever the Medicare payments are, they hype it up 20% more, they pay the providers. But they just follow the Medicare. And stupid Medicare is using your money and my money, everybody, and they're wasting. They're wasting. You know why? Because they're giving it to the intermediaries. Intermediaries, as soon as they get the money, your money, very first thing they do, oh, you are restricted to, you cannot see this doctor, you cannot go to this hospital, you cannot go to this urgent care, you cannot get this medicine. That's how they make money. They're getting Medicare. Can you believe it? Medicare, if CMS, your Center for Medicare, they would trust the intermediaries than you or me. They give your $1,200 to the intermediaries so they can restrict your care. How about that? Do you like it? Why can't they trust the Americans? Give me that $1,200. I can take care of my own health. I don't need Medicare to tell me where to go and what to do. And, Medicare Advantage. What is this Medicare Advantage? If we're being bombarded with these commercials, Medicare Advantage. And the funny thing is, they don't give you the insurance company. Have you noticed that? You have these 800 numbers. They're disguised. Which insurance company is advertising? Because they're taking your money from Medicare. Every month they get $1,200 from you. And very first thing they do, they take away your right, your access to healthcare. You cannot see this doctor. You cannot. Give me that $1,200. I'll put $500 to the insurance. I'll get my own insurance. And I'll put $700 into my own pocket, into my savings account. Why can't CMS, Center for Medicare, trust Americans? They would trust the intermediaries. Who are these damn intermediaries? Why are they making money? Why can't I make money? Yes. This upsets me the most. Why can't they trust the Americans? Invest that money in us. Give that money to us. Why give it to the intermediaries? And they're reaping the benefits of my hard-earned money. This is insulting to the Americans. Yes. What Washington is doing, what Medicare is doing is they're pumping the money into these intermediate organizations instead of investing in Americans. Give me that money. I will take care of my own. I don't need damn Medicare telling me where to go and what to do. I can take care of myself. What is this Medicare Advantage? This Medicare Advantage is not an advantage, folks. It's a managed care organization. It's a misnomer. They just they bombard you with, oh, free eye care, free dental, free this checkup, free telehealth. But ultimately, who is responsible? Because they think they're the only one who can solve. Ultimately, what I see is these providers, these hospitals. I don't, something has got to change. Providers like doctors and hospitals have to be less regulated. This is what boggles me. There is so much. They're choking these hospitals and doctors with regulations. Look at the food industry. Look at the food industry. Amazon is in the food industry. I want Amazon, Google, everybody to be in healthcare, man. They need to be in healthcare. They need to have this business of healthcare, and we need to deregulate the healthcare. If you want to put a hospital bed, $10,000 to $12,000 per bed. I'm talking to construct a new facility because there are umpteen amount of regulations. You know, regulations are choking. This is where we need to work on is how do you deregulate? How do you deregulate healthcare? Because look what they have done to the food. What is the difference between food industry and health? I don't see any difference. Food is a public safety, folks. Why can't you compare the healthcare to the food industry and deregulate this healthcare industry? And hospitals can survive. All these hospitals are going belly up, and physicians are under the gun, and these attorneys, lawsuits, tort, they all need to be under. We need to have a tort reform. We need to limit the cap. We need to cap the and these lawsuits. We need to cap the lawsuits. You cannot be emotional in when there's a jury out there. The jury should be made of healthcare professionals, man. You don't need common. They don't understand the healthcare. You cannot award them by the emotions. You need to award them by their wrongdoing, basing on the facts. And only healthcare professionals like doctors and nurses should be on the jury, not common folks, which are non-medical professions, should not be on the jury. This is where we need to change. Jury awards have to be based with a jury made up of healthcare professionals. And we need to deregulate this. Certificate of need. Come on. You open a grocery store, you need a certificate of need? Come on, man. You need a certificate of need to open a grocery store? What is the difference between a healthcare and grocery store? Vegetables and health. There's a public safety, man. Public safety can be achieved you don't choke them and put restrictions and raising the cost of the healthcare. We need to deregulate the healthcare like what we did to the airlines. I keep bombarding with it, deregulating the healthcare. Ashpart. If you want to build a hospital, you have to go through the Ashpart. Man, that is a bureaucratic nightmare. They don't realize every time they come up with more rules, so it raises the cost of the bed. No wonder hospitals are bankrupt because they're not able to survive with so many regulations out there. We need to deregulate the healthcare, like what we did to the food industry. It is the same category. Food and health is the same. And this is our asset. Americans know how to take care of their health. We can lower the premiums. I can shop. I should be able to shop for my I should be able to shop for my health care. I should be able to get a lower premium on healthcare. And we need to be transparent. I wish insurance companies are risk segmented, not risk pooled all over. You need to segment it. The risk segmentation is such where if you're in the well category or if you're at risk category or you have a chronic illness category or catastrophic category, basing on those four categories, you can base your premiums on that. But they don't do it. Insurance companies don't do that. They just pool everything. And your premiums are also, you're paying for uncompensated care. People are getting EMTALA. I am not sure how many people of you. EMTALA is a regulation. If you go to the hospital, if you don't have insurance, if you go to the hospital, hospitals have to provide the care. They can't deny for emergencies. So hospitals are under the gun to provide the care, and they don't get paid for it. That's the beauty. They don't get paid for it. No wonder the hospitals are. That needs to be revamped, and it should be. It's a government's responsibility, not the hospital responsibility. How do you need to come up with a solution? How do you pay for uncompensated care? They need to come up with a solution, but don't put the hospitals. You need to reimburse the hospital. That's the only way they can survive. And Medicaid, Medicaid is useless, man. It's people, people with low economic, they're not getting the care. Physicians don't want to take Medicaid or Medi-Cal. It's a useless insurance as far as I'm concerned. Nobody wants to take Medicare. And they keep coming up with. There should be a better way to help the poor. I would rather have, if you're in the low socioeconomic category, I would have everybody, they should get a life insurance. I think 100,000 life insurance for lower income category people. That's the least the government can do. Get the life insurance, and the health insurance, it has to be based on personalized health care, not risk pool the entire. There are a lot of folks are in the well category, in the lower excess social, and their premiums are hardly anything. You can't just broaden the thing. People in the lower socioeconomic, they're healthy. If they have a chronic disability or impaired, we should focus on them, not focus on the entire and give the risk to the entire population. Come on, man. You really need to focus on people who need the help, not, and you need to focus on how to solve uncompensated care. Don't punish Americans for uncompensated for for the things you're not able to do it. Don't punish the average Americans for uncompensated care. That's why the premiums are going up. You need to address how do you address people? 28 million Americans have no insurance. Focus on them and try to come up with a solution. California has done, what about the covered California? That's good, but you cannot raise the premiums on average folks, day to day, hardworking Americans. So far, you guys are enjoying this morning coffee with Consumers Doctor. I will come up with more and more stuff on healthcare if you join me on everyday morning coffee with Consumers Doctor, Dr. Bengal. I will be here for at least for 30 minutes. I'm not sure how long I've been here right now, but this is the end, folks. So I'll stream you again, and I'll probably tomorrow. I'm not sure. I might go. I may not be able to stream, but I'll be on a regular basis. You'll be able to see me. Morning coffee with Consumers Doctor. Please make some comments. I'm still not. I think I have the chat room set up. I need to listen to your comments so I can address and focus on. I need to connect with you guys. That's my goal. I need to connect with you. I'll see you again. Welcome to the Consumers Doctor. Morning coffee with Consumers Doctor. We will have fun. We will have fun talking about healthcare. Hey, I'm retired, man. I don't need to worry about. You know what? I should tell you. About I have been retired. It's almost 7 years now. The reason I had to retire because one patient of mine, family member, complained to the medical board and they yanked my license. Can you believe that? I want to thank this lady, whoever complained to the medical board about whatever it is. I want to thank her. I love it. I enjoy. I'm in total. I'm not shackled as a doctor. I'm no longer in shackles. I can express my opinion. I can help you guys. As a physician, I, I know. As a physician, I fulfill my dream, and I now my focus is on you, all you guys, to make money in healthcare. My main focus is on consumers. That's my ultimate goal, where consumers should have, by the time they retire, they should have quarter million, half a million in their savings. Yes, I'm talking about average folks. I'm not talking about millionaires. I'm talking about average income earners like 50, 55. They can have in their health solutions advantage. I'm not kidding, quarter million to half a million in their account. And they are in charge. They are in the driver's seat. That's my goal, man. This is my goal. And I want you guys to listen to what I'm saying, and everybody can do it. And people out there have to focus how to put money aside and be healthy. That's the ultimate. If you're healthy, you save money. There's no doubt. We can solve this obesity problem right here. If we have this so-called personalized healthcare, we can solve obesity in a heartbeat, man. Yes, you know, it is things which everybody, we have these fitness centers, yoga centers. We're all focused on healthcare. But when it comes to food, man, we just don't focus on the food. You need to watch out what you eat. You need to do exercise. I did my 4 mile marathon already. I do daily exercise. Get up 4:30 in the morning, go for a Kangoo run, Kangoo shoes. I run on Kangoo shoes, 4 miles at 4:30 in the morning, and I'm ready for a 6:30 morning coffee with you guys. Let's do that every day. That's my goal. I go on a Kangoo shoes for 4 miles. I listen to several podcasts which I like. I come back and tell you what you guys need to do. That's the way to go. That's the way to, and you have the whole day to whatever, if you're working for a company, you still have. So this is what I do. It's focus on you guys, how to come out ahead on healthcare, health insurance. Have a personalized health insurance. I will help you set up health insurance. As a matter of fact, I'm focusing on helping you to get a personalized health insurance. That's my goal. Thank you for joining. We'll see you again. If not tomorrow, maybe the day after at 6:30.